Hello and welcome back to the show. Today I have a very special guest, Nicola. Hello, how are you?
Everybody. Hello, I'm good. I'm good. How are you?
Good, good. I'm really excited to have you on the show today because we're talking about your up and coming program. I'm
Woo.
excited. Are you excited?
I'm very excited. Yeah, super excited to get it out there finally. I feel like we've been talking about it for so long.
We have this for everyone listening, this has been something that we have talked about for I feel like almost like 2 years or something.
Yeah.
I feel like I've been planting the seeds for education for like 9 years.
Yes.
And I'm like, one day I'm going to have education.
Yeah.
And we're finally here, so we're there. But for everyone who doesn't know Nick, she's just going to give a little introduction about herself. Tell us who you are, what you do.
Yeah.
Yeah.
My name's Nicola. I'm an exercise physiologist, as probably most of you listening might be. But I own an EP clinic in the south of Sydney. I've been running the business for almost 7 years now. Um, and yeah, we are a sole EP practice. We see a bit of everything and anything. So yeah, I am a very good generalist as an EP, but I have done a bit of further study into the oncology space. So I did my master's in exercise medicine oncology. I started that 2019, I think.
Was it
Uh,
2019?
I think so. Yeah,
Wow.
maybe
Because I
2020.
already knew you
It
then.
all it all blends into
Yeah.
one.
You're like, I don't know.
Um,
Sometime before today.
Yeah, I was almost about to defer, and then COVID came, and I was like, great, I think I can keep running my business and doing uni at the same time. Um,
Yeah, that's right. You did too. I remember
COVID was
that.
a blessing for uni. But yeah, did that study and have been seeing more and more kind of oncology patients since, and am really passionate about the area, and yeah, keen to share some education and get more EPs feeling more confident with this population.
Yeah, what was it that actually drew you to working with oncology? And what do you think that is misunderstood about this population? I don't actually see a lot of, I don't think I see anyone in the oncology space. So I'm also learning in this with you. But can you tell us a little bit about that?
Honestly, like I feel like I have always have this curiosity to keep learning,
Yeah.
and keep learning more things. And I kept seeing things about the power of exercise. Like I think we touch on it at uni a little bit, but there's been so much emerging evidence, and so much really good quality evidence about exercise as medicine for cancer patients. And I guess I kept having clients walk in my door that were coming in for other issues but had cancer histories.
Mm,
And I kind of had no idea what I needed to consider for these clients. It was like, is this even relevant? Like, do I need to know anything about this? So, like, generally, I started kind of just asking these clients more questions.
mm.
Um, what did they know about exercise during treatment? What kind of treatments did they have? Just trying to learn from people who had lived experience. How many of them did exercise during treatment? What were they told about it, or were they told to rest? And like it was really evident that there was so many women that were super well educated and really kind of strong, active women who suddenly had no idea what to do with exercise and didn't
Mm.
know what they could and couldn't do. They weren't being given advice. And I kind of straight away was like, I can help these people more. I think there's such a big opportunity here. And me being me, I went to the extreme, so decided to enroll in my master's and did uni from there. I didn't start with a little weekend course. I just was like, no, I'm doing this. I'm committing hard. And yeah, kind of haven't looked back. In terms of what I feel like is like misunderstood in this population, um, is like it's not about or not just about the physical side of things. So
Mm.
yeah, there's the exercise prescription, and yes, we can improve people's strength and their muscle mass and we can get all these really good outcomes, but people going through cancer treatment from diagnosis all the way through to survivorship just have so many things out of their control. and we can help them be that one thing that they can control in their life and kind of empower them. And I think there's such a big impact outside of all the benefits that we know, like our strength and muscle mass and kind of the list goes on. But just being someone who's well informed that can help support them um, is huge. We can have such a big impact.
Yeah, I also would imagine that there's quite a degree of soft skills involved with this. Like I don't actually know, like I think I'd want to tiptoe around the topic. Like I
Yeah.
kind of think it's like exactly like pelvic floor health is like if you don't really feel comfortable with someone saying, "Oh, this is problems with my pelvic floor," it's actually like a bit confronting as a clinician if you haven't done any study in it and you don't really know how to handle those conversations. And I think that in itself is like something that is probably quite hard when you're like, "Oh, you have cancer.
Yeah.
Oh, what do I
And
say?"
I
Like,
think sometimes people come in and they almost feel like they're becoming a doctor themselves. They start knowing all these really
yeah,
medical things that they've never known about. And if you have no idea about it, it's like, oh, I can't even ask questions about this. Like, there's,
yeah.
it is really hard.
Yeah. Do you, this is like a little bit off the topic of questions that I had for you, but do you find that people are getting referred to exercise physiologists during their cancer treatment?
Yes and no.
Mm.
I feel like it's probably really varying in the caseload that I see currently. Some people are told from day dot, you need an EP, you need to exercise. And then I feel like the other end that I often see is exercise is really beneficial. They've been told by one of their specialist oncologists, but they haven't been told who to go see or who
Okay.
to access or how to do that or how they should be doing that.
Yeah, okay.
And so those people are kind of taking that initiative.
Yeah, so
Um,
if you were someone looking into building like a specialization in this field and the research is so strong, it's actually really quite beneficial to link in with these specialists where
yeah,
you're like, hey, this is
absolutely.
what I do. I'm like
For sure. Yeah.
specialized in this. Yeah.
Yeah.
Yeah,
Thankfully,
okay.
like a lot of cancer treatment centers are now got physios or EPs on board. The kind of privately owned clinics, we're seeing lots more of that, which is awesome. But I think we can still get bigger and better and just help more people.
Yeah, right. So, I don't even know if we've actually mentioned this yet. We just dive straight into it. But the course itself is actually called Exercise Oncology Breast Cancer Mastery. So it is specific to breast cancer. There might be future ones because we've already talked about that. But that's what we're diving into in specifics for women's health. So a lot of this stuff is, we're going to be talking about breast cancer, but a lot of it does cross
Yeah,
over
I think
into
like the start of
oncology
the
in
course
general.
is I think the start of the course is a bit of like what do you need to know in oncology, and that goes across all cancer types. It's not specific, but then we dive into kind of what does a breast cancer treatment kind of continue
Mm,
like in general. Obviously everyone's a little bit different, but yeah, then diving a little bit more specifically into breast cancer things. Side effects do cross over
mm.
with different types of cancer and different oncology patients, but yeah, definitely applicable across other cancers as well.
Yeah, so when you first started seeing, let's say, oncology clients or breast cancer specific, either or, we're going to like bridge it all together. Were there particular knowledge gaps that you actually first noticed in terms of how to treat or what to say, or even just your confidence level that you think a lot of other people might have and not realize yet?
Yeah, I feel like I actually knew very little when I first
Oh,
kind of started
okay.
seeing
Just like a
cancer.
zero.
like like really like the little bits that we learned at uni where it's like exercise is beneficial and then you learn the fit principle and it's like okay, everyone should be doing 150 minutes of moderate
The fit principle. I feel like it's just the same for every
for
person.
every
150
condition.
minutes.
Yeah.
Can't go
Uh,
wrong.
like I'm a good EP. I can figure out how to get someone progressively there, but like, what do I actually need to know? And then I think as I started seeing more patients, it was like, oh, okay, like early menopause, like low bone density, like increased cardiovascular risk profiles can all be linked to various breast cancer treatments.
Mm.
Like maybe I actually need to understand more about how they're related and what thing, as I said, if someone's got a breast cancer history, like, is that actually relevant to me? And I was starting to learn, like, yeah, maybe it is. Like, maybe that's going to contribute to all the other things that I'm kind of seeing. So, like, I was in an EP clinic, as I said, we're a big generalist clinic. And I had myself and a new grad staff member. And I had a moment where I was like, if someone walked in right now and they were going through active treatment and wanted my help, I probably would refer them on. Like,
Yeah.
I don't think
Okay.
I could have given best treatment to them at that time. And for me, that's like I need to do something about that. Like, I want to be able to confidently see anyone and
Mm.
everyone that walks in my door. And yeah, I really didn't feel confident doing that. And when, like, I didn't even really know like what chemotherapy was. Like, I knew it was this horrible drug, but like that was it. Like, I didn't even know
Yeah.
how it was delivered, or like, what it looks like for someone going through chemo. What does that actually mean? Let alone you then like throw in all these scary kind of side effects. You've got fatigue and chemo-induced neuropathy and lymphedema and
Yeah.
cording and like, all these kind of scary things. So yeah, I really felt like I didn't know much at all before I started doing stuff.
Yeah, honestly, I've learned most of it from you. So I'm just like, I would honestly be the same. If someone actually said it to me now, I would be able to take the pelvic health perspective of it. But the actual like cancer side of treatment, I'd be like, yeah, let me just call my friend Nick.
Yeah.
Or maybe you could just go see her.
Yeah.
So I,
That's how I felt really. Like,
yeah.
I just wanted to be better.
And the history, I think that is also something that does pop up quite a lot in heaps of other things in the future. You know, they're actually coming to you for something completely different, but it pops up and you don't really know whether or not you should be worried about something
Yeah.
else. Like even like you said, like the bone density side of it, and if that is actually of concern, like if they've got some serious bone density issues, then you probably need to consider that with your exercise prescription now.
Yes.
But
Yeah,
you might not think to ask that if they're coming for something completely different.
yeah, or
Mm.
like they actually have some like long-term latent side effects that a cockatoo too just flew into my window. Sorry, that scared the crap out of me.
I just
Um,
saw you jump on the screen. I was like, what's going on?
watch this video later. Enjoy.
Yeah, go back and watch this on YouTube.
Um, back to where I was saying. Yeah, like people have these long-term latent side effects that you might not even ask about if you're not aware that it could be related. And like,
Mm.
people don't bring up everything when they first come and see
No.
you. They're like, I'm here for knee pain. Like, why is that relevant? And
Mm.
we know that we can help them with it all, and it is relevant.
Yep. And sometimes it's like, sometimes I feel like in EP, the buy-in takes like a bit, like with that,
Yes.
we're here for long-term exercise. So if you like, I don't want to say like bombard them, but if you just like have this level of confidence and depth of knowledge that people are like, wow, this person really knows what they're talking about. Like, I feel safe in this
Yeah.
person's hands. Like, I have no doubts that this is going to help me.
Yeah.
That in itself, I think, is such a good feeling to have in clinic.
Yeah. I think it was I remember vividly my first breast cancer patient, like someone going through active treatment. Um, and I remember she was telling me like things that she was going through, and I was able to be like, "Oh, you've got this like subtype." And she's like, "How did you know that?" And I was like,
Oh,
"Well, I know based on like the treatments that you're having." And straight away it was like she trusts me. Like
yeah.
that was one thing that I said that she's now a client for life.
Yeah. Yeah.
Um, and
Oh, that's cool.
yeah, it just gave me goosebumps.
Yeah, I got it too. I was just like, oh, that's so cool. So when we think about exercise for cancer treatment, can you give us a little bit of a sense like what that actually looks like in a clinical setting, whether it's like during, post treatment?
Yeah, it obviously like changes so much where someone is on their like cancer kind of journey.
Mhm.
And I kind of touched on it before, and it sounds super cliche, but we have the power to give someone control in this super scary kind of time of life, and where they're just exhausted from everything.
Mm,
So I think that is honestly like the real power that we can bring, giving them kind of a sense of identity and helping them feel more comfortable in their body and getting them to feel like they can move and that they are like normal and they're okay. Feeling strong again when like everything else in their world seems to be falling apart.
Mm.
We have such a big, powerful place that we can hold for someone, and help them realize that. And we know that like the evidence is so strong. So like reducing treatment related side effects, like preserving lean muscle mass, maintaining favorable body composition, all those sorts of things help improve survival outcomes. They help reduce the risk of recurrence. So there is so much we can do from an exercise prescription perspective. But we think it's not about like chasing PBs and heavy lifts or completing marathons. That might be down the survivorship journey for sure. But like thinking helping someone being able to raise their arm overhead or do their bra up again after they've had a mastectomy, or like her coming in with fatigue and it's like so intense, but she's turned up, and showing her that she can still do something.
Mm.
Uh, it's like knowing the science behind uh, exercising immediately before chemo and how that enhances drug uptake, getting them to be more empowered, and
Mm.
not just kind of treating and exercising for the sake of exercising. We are kind of that bridge between their medical side of things and their like recovery and like living a really full life. And I think that's really cool.
That is so cool. We're going to dive so much into the exercise prescriptive side
Yes.
of this inside the program because that's a big, big component of all the things that are hosted in her education is the practical side of things. So there will be a lot of that. And it looks good from what I've seen. But what's from your own experience when we think about misconceptions within either exercise, phys, careers or even health professionals in general, what are they or what do you think they are when it comes to prescribing exercise for breast cancer clients?
I mean, I think number one is when you're not well educated, it seems really risky. It's
Yeah.
like, it's like, do we just wait until treatment's over? Like, come and see me later.
Yeah, I think
Uh,
I probably think that. I'd probably
yeah,
be just like, oh, I'm a bit scared to do this, so I just won't do anything.
yeah, but like the evidence is there. Like exercise during treatment is not only safe, but it's incredibly beneficial.
Mm.
It helps support immune function, like we said, preserve muscle mass, improves drug uptake, helps reduce side effects. So people who exercise throughout treatment suffer less side effects, and less severity
Mm.
of side effects. So it's not too risky. And there's so many things that we can do. I think another kind of thought is that clients might be too fragile or like we just need to kind of wrap them in cotton wool while they're going through active treatment. It's like, yeah, we need to be careful, but we also like there's nothing wrong with loading people. Um,
Mm.
like we shouldn't be scared to get them moving. And they're strong people. Your body is able to adapt and heal and recover, and that's what it does really well. And so we can let it do its thing while we do our thing and keep exercising and keep moving. It's more about personalizing things for people and making it individualized rather than avoiding things or wrapping them in cotton wool.
Yeah. Yeah.
But I also think there's so much to navigate. Um,
Mm.
and that can be really daunting for health professionals, um, when we're talking about things. If you're not aware of it, if you don't know what it means, if people are suffering things really long term, it could be 10 years post treatment and they're still suffering side effects. You can have two clients with the same diagnosis, but completely different treatment pathways, completely different functional capacity. And they look like two completely different clients. And I think there is so much. It's like we talk about lymph nodes and cording and scar tissue, menopausal effects, fatigue, like hormone therapy effects, so longer term drugs, bone density, joint pain. Like there's so
Mm.
much going on, and it can be really daunting, I think.
Yeah.
Um, we can absolutely like understand that better, and we can do so much. But I think we need to be well informed about it all so that we're not under prescribing, we're not over prescribing. We're kind of finding that Goldilocks spot of just right.
Yeah, which is something that comes to mind when you talk about this is when you're in a clinic that's maybe a little bit more generalist, or maybe you're a sole EP in a multi-disc disc environment, or um, there's no one else who has like that level of knowledge around this. You know, I had this problem in pelvic health where I was like, I was the person that people ask. So, like, who do I get education and knowledge from? And there's nothing worse than like, I really want to help these people more, but like I can't really promote this because I don't have the skill set to actually treat, but I also need to know a bit of knowledge to treat them and then get them to come in and keep practicing and like
Yeah,
learning
it's
more. And
an
it's like
awful cycle where it's like,
this
I need to teach
yeah.
some of those patients to be better at it, but I don't feel confident, so I don't want to advertise it. So you get stuck in this like
Yeah.
cycle. Yeah,
Yeah.
absolutely.
And it's almost like you just have to be like, all right, I'm going to do all of the education side of things, feel a bit more confident in at least my knowledge, and then dabble in it and build it as I go. But like when you say it's really daunting and you think it's too risky, like those are the really big things that I think come into play when you don't have maybe that sort of like workplace mentor where they're like, yep, I know all about this, I can help you. And you've got that person to ask questions, you know, if the person's come in for their initial, you've found out they have this history, and then you're like,
Yeah,
oh, I just want to go ask someone.
yeah.
And if you don't have that, it's actually really quite hard to like
Yeah.
have that support.
I think like even in my staff members, I had someone last week and I was like reviewing one of her initials that she did, and this woman had a breast cancer history and a few things popped up, and I was just like, "Oh, did you ask this? Like, what did you find out about that?" And it was like, "Okay, we need to dive more into this and having someone, but if you don't have that, like you've got to learn it somehow."
Yeah, 100%. And that's the scariest part is like giving it a go when you're not really that confident. But
Yeah.
there's actually quite a lot of support within these programs, which is something that I'm quite excited about
Yeah.
personally. But
And I think that we always talk about when we chat is like not just doing education for the sake of it. It's like doing better for yourself professionally, but also so that you can show up better for clients.
yeah, oh,
Um,
100%.
Not just a tick box of here's my points for the year done.
Yep, 100%. If you listen to the episode that came out before this one, you'll know all about this topic because I have touched on it. But what are you like? You're basically designing this program. Like we're doing it collaboratively, but the actual education side is from you. What are you most excited about in terms of this and sharing with EPs?
I mean, I think, as I said, we talk lots about the value of education and
Mm,
good education. I think this is super exciting. One, to get it out there, but like two, to have something that's not just theory, it's like actual application. It's like breaking down all the complex side effects, throwing in case studies that are like real world clients that I've actually seen, that I've worked through problems and barriers, and like, here's my exercise prescription. This is what we did. Um,
yes.
yeah.
That was a requirement. I was like,
Oh, yeah,
this needs to
absolutely.
have all of this in it. And
Yeah.
you agreed anyway, but
But it's also touching on like incorporating those soft skills. How do you help empower those people, not just through exercise prescription as well? How do you think clinically and adapt on the fly and all those things? Kind of as much as we want to make a client feel empowered, I want to kind of empower more EPs to feel like they can best serve this population and their clients.
mm, which is so awesome. That's like something I'm so excited about these programs is like bringing it all together and having someone like yourself teach this. So, to give you a little bit of insight into the format, it's a live delivered program. So we've got like a 4-part series. It's every week for 4 weeks. And then there's a follow-up support call after that where we can do Q&A or dive into more specific components. But there's also a community component to it throughout the program as well that Nick will be jumping in to answer questions for anyone that has questions about. So there'll be a lot more information coming out about the ins and outs of what we're covering inside that program and the rest of the formats. But that's like, it'll be quite in depth for that reason. It's not just a one-off presentation, I guess. It's like actually like a series of lessons live delivered, I guess.
Yeah, yeah.
So
I don't know. What do we call them?
live lessons.
Yeah, live
I'm kind
lessons.
of thinking about it like if I was doing uni online, these are
Yeah,
my
yeah.
tutorials.
4 week course.
Yeah, and I'm like also really passionate about the delivery online. I've done a little bit of research around delivering PD online and how it is effective and what it should feel like in the experience around learning. And we've chucked a couple of different things in here to help with that too. So it's exciting. It's very exciting.
Super exciting.
Super exciting. If there's someone if someone's on the fence right now and they're like, oh, I don't really know whether, like, should I, shouldn't I, maybe even about working with breast cancer clients, like, what would you have to say for them?
I mean, you don't have to have it all figured out. You don't even need to be seeing breast
Mm,
cancer clients currently. But like I was at once upon a time, how would you feel if that person walked in the door? Would you feel like you had the tools to be able to best help them? Or would you be like, I'd probably refer them on to someone else? Uh, Once you have the knowledge, you'll feel confident. So it's go out and get the knowledge. You'll know when to push someone and when you need to hold back, and you'll be able to make a real difference in someone's recovery and be a part of their cancer journey, which is yeah, really exciting. It's really touching to be able to help people in that way.
yeah, I can imagine that would feel incredible
Yeah.
because it is a pretty rough time for them, I would imagine.
Yeah. And yeah, you get to be one. I mean, for me, the way that I see people, we're usually seeing people a couple times a week, or even if
Mm,
it's just once a week. Sometimes you see them more regularly than some of their other health professionals, and you're the person they see most. You do have such a big impact. But yeah, it's important that you have the right knowledge to be able to give them best treatment.
yeah. Great to hear. I think I'm really excited to launch this. So stay tuned on social media if you are interested in this. We'll be sharing it mostly through Instagram on my email list. Nick will be sharing it through hers as well. But I would encourage you to reach out and ask any questions if there's anything that you want more clarity on within either the program or the format or whatever it is, please don't be shy, reach out. But otherwise, we really hope to see you inside. It's going to be super exciting. And yeah, I'm pumped.
Very excited. Can't wait to see everyone.
Yeah. So thanks very much for sharing all the insight, Nick. I really appreciate it. And we'll see you when the course opens.